Hi, I am Sharissa. I'm a pharmacy technician student, and today I'm going to show you how to use a Humapen for an insulin injection. So this is your pen. This end is the cap that we will eventually remove. Down here is the dial that you can simply just turn. Here's the numbers here to show you the number of units that you're going to be injecting. And then this silver piece down here is the injection button that you will push to release your dose into your skin. To use the pen, first we take off the pen cap here and we'll set it down, and we're going to take this clear piece off. This is the cartridge holder. We're going to remove it from the pen. You'll place your insulin cartridge into the cartridge holder with the small side in first. And once it's in there, you can go ahead and twist the cartridge holder back onto the pen until you hear that click. Because this is cloudy insulin, we'll want to make sure that we mix it gently before we use it. So we'll want to roll it a good 10 times, and then we'll want to make sure we tip it upside down 10 times to make sure that it's mixed evenly. Next we have to attach the needle. So you'll want to grab one of your needles. I'm not going to do it just because I'm not going to use it, but you would go ahead and twist this needle onto the top piece here. So you'll remove this paper wrapper, twist your needle cap on to the cartridge holder, and then you're going to remove this clear piece. That's the needle cover, and then there's a green piece in here. We're going to remove that as well, and that will expose your needle on the top there. And just hang on to the cap and save it for later. Next, we'll have to prime the needle to make sure that you get the correct amount of insulin and make sure that there's no air in here that we're injecting into your body. So in order to do that, we'll hold it up like this with the needle pointing upwards. You're going to turn the dial on the bottom so that the red line here lines up with 2. It kind of looks funny looking at it from this view, but we'll set it to 2 units. And then we'll push the insulin injection button, and the air should push out. We'll want to make sure that we see some droplets of insulin come off the top there. If you don't get a steady flow of insulin, just go ahead and repeat those steps just to ensure that there's no more air left in there. Once the needle is primed, you can go ahead and turn the dial to the correct dose that you need in units that you're wanting to inject. When you're ready, you can go ahead and stick this needle into your skin, however your doctor told you to do so. And you'll want to push this injection button in, and we're going to hold it for 5 seconds to ensure that all of the insulin was injected into your body. And after the 5 seconds, you can go ahead and pull the needle out of your skin. Then you'll want to just have a look and make sure that the gauge down here reads 0. If it doesn't, that means you didn't get all of your proper dose. So you'll want to go ahead and stick that into your skin again and go ahead and push the injection button and make sure that you did receive your full dose. Make sure you push it and hold it for another 5 seconds. When you're done, you can go ahead and take your plastic needle caps and stick them back on your needle just so that it's not exposed anymore. And you can go ahead and twist it off, and you'll want to put this into a sharps container. And then you can go ahead and place the cap back on your insulin pen, and you'll want to make sure you store it in a cool, dry place until you need it for your next dose. Thank you.